Good morning everyone. Today's topic is periodontal abscess and its treatment approach. What is a for introduction of a periodontal abscess? The abscess is a localized collection of pus. Pus, periodontal material that is collected in a cavity which are caused by a destruction of the tissues. Abscesses of the periodontal have been classified primarily based on anatomical locations in the periodontal tissue. These are of three types, that is the gingival abscess, pericoronal abscess, and the periodontal abscess. The prevalence of an abscess, it is the third most prevalent emergency infection after the acute alveolar abscesses and the periodontitis, more likely to occur in a pre-existing periodontal pockets. And it involves more in a molar side, that is more than of 50% of the cases. Classification of periodontal abscess. Depending on the location of abscess, it is classified as a gingival abscess and the periodontal abscess. The gingival abscess, that is localized painful swelling that is affecting only the marginal and the interdental gingiva, mainly mainly due to the impaction of foreign objects. It may be present on a previously in a healthy gingiva. While the periodontal abscess, it is with the similar symptoms, usually affect the deeper periodontal structures, including the deep pockets, perforations, and the vertical osseous defects. That is usually located beyond the mucogingival junction. Second, depending on the course of the lesion, it is a acute periodontal abscess and the chronic periodontal abscess. The acute periodontal abscess, it presents with the symptoms like pain, tenderness, and sensitivity to the palpation and the suppression upon the gentle pressure. While the chronic periodontal abscess, it is normally associated with the sinus tract and usually asymptomatic. It can refer the mild symptoms. Depending on the number of abscess, it is classified as a single periodontal abscess and a multiple periodontal abscess. In a single periodontal abscess, that is related to the local factors which contribute to the closure of a drainage of a periodontal pocket. While the multiple periodontal abscess are seen in uncontrolled diabetes mellitus, medically compromised patients, in patients with the untreated periodontitis after the systemic antibiotic therapy for the non-oral reasons. According to the periodontal tissue affected, it is categorized as the gingival abscess, periodontal abscess, and the pericoronal abscess. The gingival abscess, it is seen in previously healthy sites and caused by an infection of a foreign body. The periodontal abscess, it is either an acute or a chronic that is developing into the periodontal pocket. And the pericoronal abscess is a incompletely erupted teeth. Depending on the cause of an acute infectious process, periodontitis-related abscess, when the acute infection originates from the biofilm present in a deepened periodontal pocket, while the second is a non-periodontitis-related abscess, when the acute infection originates from the other local source, such as a foreign body infection or alteration in the root integrity. Based on the location of an abscess in the supporting periodontal tissues along the lateral aspects of the root, that is a sinus tract present. Abscess in the soft tissue wall of a deep periodontal pocket. What is the pathogenesis of the periodontal abscess? The sequelae of a periodontal abscess is as follows. Infiltration of pathogenic bacteria that occurs in the gingiva, then it causes a initiation of an inflammatory response that further causes a tissue destruction which are caused by the inflammatory cells. Then there is a formation of an inflammatory infiltrate, destruction of a connective tissue, encapsulation of a bacterial mass and the pus formation, and entry of bacteria into the soft tissue wall initiates the periodontal abscess formation. What is the etiology of a periodontal abscess? Etiology of a periodontal abscess, that is categorized into the three factors, that is the environmental factors, microbiological factors, and the other local factors. The environmental factors, first, that is a pocket, the pre-existing pocket, major factors. It is a major factor. When there is a deeper, narrower, tortuous type of pocket are present, there is a more chances of involvement of a abscess. Microbiology. The periodontal abscess is the most commonly caused by anaerobes. The P. gingivalis that causes abscess in 50 to 100% of cases, and periodontal pathogens usually isolated from the periodontal abscesses. These are the F. nucleatum, D. forceps, P. gingivalis, P. interval. 45% of the anaerobes that resembles the periodontitis microbiota. These are the polymicrobial, non-motile, gram-negative rod-shaped anaerobes, which are mostly causing the abscess formation. Then P. gingivalis is one of the cause for the periodontal abscess, and the other microbes which are included in periodontal abscess formation are the P. intermedia, P. melanogenica, nucleatum, forsythus, and the sparagetes. Viruses in the periodontal abscess, these are the cytomegalovirus and the Epstein-Barr virus 1. The other local factors are the foreign materials such as the popcorn husk, impacted food, fish bone, toothbrush bristles, and the irrigating devices and the anaphorotic effect. Then diabetes and the periodontal abscess. There is a low host resistance which are existing in diabetes mellitus. So there is a decrease in chemotaxis and the phagocytosis is present, and there is an altered collagen metabolism is present. How to diagnose for the periodontal abscess? So diagnosis of periodontal abscess that is based on the chief complaint and the history of a present illness. Points to be noted while taking the history. First is any medical condition it is having patient or not, whether the patient is currently on medication or not, any previous dental treatment he or she has taken, their smoking history. The main steps and the aids in the diagnosis are: first, that is a general examination. Just do a general examination of the features that may indicate ongoing systemic diseases, immune status, fatigue, extreme conditions. And the external examination, you have to just go for the evaluation of the symmetry of a face for swelling, redness, fluctuance, sinus, trismus, or the examination of a cervical lymph nodes. And the intraoral examination, just go for the examination of a oral mucosa, dentition of a gingival swelling, redness and the tenderness, checking for the suppression, checking for the mobility and elevation, then evaluation of oral hygiene and examination of periodontium including the periodontal screening. Then the other than that of that, there are also supplemental diagnostic aids are there, which includes the radiographs, fertility test, microbial test, and the lab findings. First, radiographs. The radiographs, radiological techniques such as the IOPA, Bitewing, OPG, these are useful in a detection of a level of a crystal bone, the marginal bone loss, and the periapic health condition of a tooth that is involved. The pulp fertility test, you have to just do this test for checking the pulp fertility. The thermal test or the electrical test, these are used to assess the vitality of a tooth and the subsequent ruling out of a pulpal infections. Then the microbiological test. Just take a swab from the area that is abscess area and send it for a culture and the sensitivity test. And the last that is a lab findings. The lab is such as the PLC, DLC, who are elevated levels can be an indication for the inflammatory response of a body to the bacterial toxins. And then assessment of a blood glucose level through the HbA1c test and the random blood glucose test. Fasting blood sugar glucose levels is mandatory in a diabetic patient as it can predispose to the abscess formation. Okay. The supplemental diagnostic are the radiographs, fertility test, microbial test, and the lab findings. Then the differential diagnosis for a periodontal abscess. The periodontal abscess should be ruled out from the following similar conditions and the lesions. First one, that is a gingival abscess. The gingival abscess is the differentiating features of a gingival abscess are there is a history of recent trauma, the localization to a gingiva, and no periodontal pocket is there. Then the periapical abscess It is differentiated from the periodontal abscess by the following characters. That is it is located toward root apex. There is a involvement of a tooth. The tooth which is involved in the abscess. It is a non-vital tooth. Then the large caries with the pulpal involvement is there. Then sensitivity to hot and the cold. In the periapical radiolucency, these are seen on a IOP. The next, perioendolesions. This is differentiated from the periodontal abscess by a severe periodontal disease involving the thircation. Severe bone loss, which is seen at a close to the apex. The non-vital tooth, which is sound or minimally restored. In the endoperiologians, they differentiated from a periodontal abscess by a pulpal infection that is spreading via the lateral canals. The tooth non-vital in the periapical radius and the localized sleep property. Then cracked tooth syndrome. It is differentiated from the periodontal abscess by history of pain on mastication. The cracked line that is located or noted on the crown. The tooth is vital tooth. There is a pain upon release after biting on a cotton wool, and there is a no relief of a pain after the antibiotic treatment. The next, that is a root fracture. It is differentiated from periodontal abscess by it is a heavily restored crown is there. Non-vital tooth with the mobility is there. Post crown with the threaded post, possible fracture line, and the halo radiolucency that is seen around the root, which are visible in a IOPS, and the localized teeth pocketing is present. Then, what is the treatment for a periodontal abscess? Principles for the management of a simple dental infections are first, that is the local measures and the systemic management in three stages. First, local measures it includes the drainage, maintain the drainage and eliminate the cause. While the systemic management in the three stages that includes the immediate management, initial management and the definitive therapy. The immediate management it is advocated in life-threatening infections who have led to the space infections of the orofacial regions. So, go for the hospitalization with the supportive therapy plus systemic antibiotics is recommended. In a non-life-threatening infections, oral analgesics and the antimicrobial chemotherapy is as sufficient. The dosage of antibiotics depends on the severity of an infection. Common antibiotics is used for the periodontal abscess are the phenoxymethyl, penicillin, amoxicillin, metronidazole, and in case of allergy to the penicillin, you should recommend for the erythromycin, doxycycline, and the clindamycin. Initial therapy, it compromises of irrigation of abscess pocket, saline, removal of a foreign bodies if present, drainage to the sulcus with a probe, compression and debridement of the soft tissue, oral hygiene instructions, and review of the 24 to 48 hours. Treatment options for the periodontal abscess under the initial therapy, drainage in periodontal abscess, treatment of choice if no other complications are there. The steps for the drainage are first give a topical or the local anesthesia to the particular area. Then do the interaction of a pocket wall with the help of probe or the pipette. Then give a gentle digital pressure on a pocket on the outer surface of a gingiva. If lesion is small and has a good access, then treatment modality are the scaling in the curettage. If the lesion is so large and the drainage cannot be possible, then treatment modality are the antibiotic therapy, scaling, and then curettage. Drainage through an external oxygen. If the region is large and pinpointed and fluctuating, an external incision can be made to drain the abscess. The different steps for the drainage to an external incision are first give a topical or the local anesthesia to a particular area. Then give the vertical incision that is placed with the help of number 11 or the bread. The tissue lateral to the incision that is separated from the periostral elevator. Digital pressure that is applied with the gauze. In patients with a marked swelling, the tension and the pain, systemic antibiotics should be given as an initial treatment. And after the acute condition has decided, mechanical debridement is performed. The periodontal surgery, the main object of the surgical therapy is to eliminate the uh, remaining calculus and to obtain the drainage. Surgical therapy is advocated in case of a deep vertical defects when calculus is left subgingivally after the treatment. The systemic antibiotics with or without the local drainage. Antibiotics are the preferred mode of treatment. Local drainage of abscess is mandatory for to eliminate the etiological factors. Recommended antibiotic regimens is as follows: phenoxymetic penicillin, then amoxicillin, metronidazole. In case of allergic penicillin, just to move further, erythromycin, doxycycline, clindamycin. When to do extraction of a particular tooth. Extraction of a tooth or the teeth is a last resort to the treatment of a periodontal abscess. Certain guidelines for assessing the poor prognosis, it should be detected before starting the tooth. These are first, when there is a horizontal mobility is there, that is more than the 1 millimeter, just go for the extraction of a teeth, particular tooth. When there is a class 2 and the class 3 percussions involvement of a molar is there, then go for the extraction. When the probing depth it is more than that of 8 millimeter. When poor response to the therapy and the more than 40% of the alveolar bone loss is there, just go for the extraction of a teeth. Then the definitive treatment. The treatment of a falling reassessment after the initial therapy is to restore the functional aesthetics and to enable the patient to maintain the health of periodontium. Definitive treatment is done according to the treatment needs of a patient. In this diagram, you can see a forming between the gum and the teeth. This is the periodontal abscess. There is a periodontal operating room is there. Then gingival abscess. Gingival abscess. It is located acute inflammatory lesion that appears in the very smooth sometimes painful, often fluctuate the cell. The causes of the gingival abscess are microbial plaque infection, trauma, foreign body infection. These are the plaque associated gingival abscess on the mandibular right canal. What is the treatment for the gingival abscess? First, go for the topical or the local anesthesia by the infiltration. When possible, do a scaling and the root cleaning. And in more acute situation, fracturing area is inside with the number 15 and exudal treatment is prescribed. Gentle digital pressure. The foreign material is removed. The dental floss and the impression material which is on the gingiva. The area is properly irrigated. Once the bleeding is stopped, patient is dismissed with the instructions to rinse with the warm salt water every 2 hours. After 24 hours, area is reassessed if the resolution is sufficient, scaling not previously completed, undertaken. If the residual lesion is large or poorly accessible, surgical access may be required. Pericoronal abscess, it results from the inflammation of a soft tissue operculum which covers a partially irregular tooth. The common site for the pericoronal abscess are the mandibular third molar region. The causes are the plaque, food infection, and the trauma. What is the treatment for the pericoronal abscess? Area is anesthetized and drainage is done by the gently lift in the soft tissue operculum with the fluids, gentle irrigation with the sterile saline to remove the debris, and instructions are given to gargle with the salt water, rinsing every 2 hours. Once the acute phase has been controlled partially, eruptive tooth is treated with a surgical excision of a overlying tissue or a removal of a tooth, depending upon the condition of the teeth. What are different signs and symptoms of acute and the chronic abscess? In acute abscess, there is a mild to severe discomfort is there. While in a chronic abscess, there is a no or dull type of a pain is present. Acute abscess that is localized, red, avoid solid. While it is a chronic abscess is a localized inflammatory lesion. It is mostly associated with the periodontal pocket, a fissurous tract that is associated with the deep pocket. Exudation is present in an acute abscess, while the intermediate exudation is present in a chronic abscess. Mobility is present in acute abscess, and the slight tooth elevation is there in a chronic abscess. Tooth elevation in a socket is present in the acute abscess, usually without the systemic involvement. And there is a elevated temperature and the lymphadenopathy in an acute abscess. And there is a sensation of the tooth elevation, dental pocket, and exudation is present in the acute abscess. While in a chronic abscess, there is a fistula is observed in the acute gingiva. To determine the cause of the abscess, abscess and for this establish a proper treatment plan, it is necessary to perform the differential diagnosis between the periodontal and the pulpal axis. The periodontal axis that is associated with the pre-existing periodontal pocket, the vital pulp is there, sensitive to the pulpation. It may or may not be present. Pain is dull and the localized, and swelling includes the gingival tissue with the occasional fistula. While in the pulpal axis, it may have a no periodontal pocket present, so as a narrow defect. Then there is the involvement of a tooth that is a normal tooth. Sensitive to the pulpation is present. Pain is severe and difficult to localize, and the swelling that is often localized to the apex with the fissurous tract. Without its conclusion, early diagnosis and appropriate intervention are extremely important for the management of the periodontal abscess. A single tooth diagnosis with the periodontal abscess that responds favorably will not affect the longevity of the tooth. Decision to extract the tooth should be taken only after the clinical assessment. Hello. The basic question that is mostly asked on a periodontal abscess. So, after asking as a basic question, just write about the introduction, prevalence, classification of periodontal abscess, what is the pathogenesis of the periodontal abscess, etiology of the periodontal abscess, what are the diagnosis, diagnosis, how to diagnose the periodontal abscess, then differential diagnosis of periodontal abscess, and treatment part in local regions and systemic features.